following narrated presentation will provide guidance to utilize the Dentsply Sirona digital denture prescription form. Please download the form and fill it out for use with patient cases included in the purchase of the digital denture learning package kit, as well as any patient cases thereafter. The prescription form begins with information that your dental laboratory will need to provide. Please disregard these information fields and continue to the section titled Patient Information. Fill in the patient information. The date of birth can be a rough estimate, but it is helpful information for the designers to know. The 3 appliances you'll be fabricating with your dental laboratory include a biofunctional try-in and the bonded denture with portrait IPN denture teeth. The Wagner try-in and monolithic are not available with purchase of the kit. However, they can be purchased for any cases after this trial. Selections for additional options will then need to be made. I want to call your attention to 2. The post-palatal seal. If you require a post-palatal seal in the final denture, please make this selection when you're ordering your try-in devices. Also, follow impression vestibule anatomy. If you would like the borders to fall into the vestibule and be extended as far as possible, please make sure that you're providing the laboratory with a properly border molded impression. Without making selections in the additional options, the appliance will be finished and will contain the following: a matted aspect of the frontal part of the upper denture, natural rugae on the lingual side of the palate, frenulum shaping according to the impression. Without further information, the appliance will not contain a copy of mimic gingiva, a post-palatal seal, gum staining. Please clearly indicate on your impressions the outlines of these functions, including the expected height and or course of the palatal seal in the notes. You will now have to make selections for the denture specifications, starting with the tooth mold. If you do not enter any information in the tooth mold fields, Avident will select a mold based on the measurements you provide. If you're using a traditional wax rim, make sure that you can clearly identify the midline and distals of the canine, as well as the high smile line. The IPM mold chart can also assist you in selecting the proper denture tooth. The mold chart follows the anatiform TrueBite system. Over 100 years ago, the Dentist Supply Company of New York, known today as Dentsply Sirona, brought together 2 leading pioneers of prosthetic dentistry, Dr. Leon Williams and Dr. Alfred Giese. Together, they developed the harmony between the facial forms of the anterior teeth. The 7 basic facial forms are square, square tapering, square ovoid, tapering, tapering ovoid, ovoid, and square tapering ovoid. The first number on a tooth card for portrait IPN corresponds with the facial features. The second number corresponds with the proportion and contour. Using a flat device such as the Dentsply Sirona tooth indicator, select the number 1 to 6 that represents both the proportion of the tooth, long, medium, or short, as well as the facial contour, straight or curved. The number selected is the second character of the mold identification number. The letter. The letter corresponds with the width of the upper 6 anterior teeth on a curve. Using the Dentsply Sirona millimeter ruler, measure the width of the upper 6 anterior teeth on a curve, from the distal of canine to distal of canine. The measurement will fall into one of the ranges identified with the letters B through J. The letter selected is the third character of the mold identification number. Please select the proper occlusal scheme, anatomical, lingualized, or flat on flat. Keep in mind that a proper contour occlusal rim will aid as a reference for proper placement of the teeth. It's also helpful if you note the patient's classification in the brief treatment description section at the end of the form. Posterior mold selections should coincide with the patient's classification, and crossbites should always be identified. The posterior mold options are for fully edentulous, not implant retained or supported cases. Indicate the patient's shade. IPM portrait teeth are available in all 16 A through D shades. The monolithic IPN shades are limited to the following illustrated 6: PW2, A1, A2, A3, B1, and B2. Please remember that the monolithic is only available after your trial has ended. Select the acrylic shade. Dentsply Sirona digital dentures are offered in the following shades: original, light, light reddish pink, and dark pink. As mentioned earlier, please add the patient's classification in the brief treatment description area, as well as any crossbite situations. If you have any photos, please check the box for photos included, or you can alternatively email your lab with the photos. Please discuss delivery dates with your laboratory, and make sure that all impressions and records are disinfected. Finally, sign the RX form and send along with your case. Thank you for your attention, and if you should have any questions, feel free to reach out to us at dsdigitaldentures@dentsplyserona.com.